Here at UTMC, we use a molecular test for diagnosing COVID-19. And again, we're focused on symptomatic patients. That test involves getting a nasal specimen or an oral specimen. Sometimes people find that uncomfortable, but after that test is done, it's taken to the lab and processed with special equipment. And usually results are available within 48 hours. Right now at UTMC, our focus for testing is on patients who are symptomatic. And we talk about symptoms of COVID-19. Primarily, we're talking about cough, fever, shortness of breath. There can be other symptoms that go along with that. For example, muscle aches, fatigue, changes in taste or smell, and then also some GI symptoms. If you need to be tested for COVID, if you have those symptoms, the way we're doing this right now is you call 383-4545, and that number will allow you to make an appointment for COVID testing. We do test asymptomatic people under certain circumstances. So, for example, those people who are going to have a surgical procedure or those people who are going to be admitted to our hospital. The testing locations that we have for people with symptoms, people can be tested on the main campus at the clinic there. People can be tested here on the health science campus at Rupert Medical Center. And sometimes we make accommodations for other folks where we can actually go out into the parking lot and obtain a sample then. But that's why it's important to call that number 383-4545. If you have symptoms and if you've been tested, while you're waiting for your test results, you should go back home and self-quarantine until you get those results. And that's going to be for basically 10 days. The UTMC will call you with the results, and we'll also share those results, if they're positive, with the Lucas County Public Health Department. Again, we process them here, and our turnaround time to get results back to patients is 48 hours. For those people who test positive for COVID, they'll be contacted not only by UTMC, but also by their provider. And depending on what those symptoms were that prompted the testing, they'll be directed by their provider to take further action. The last thing is they'll be contacted by the Public Health Department in order to ask that person to participate in contact tracing to prevent the spread of COVID-19 in the community. So here at UTMC, we have 4 objectives that are related to the COVID response. The first is to keep ourselves safe. So all of our staff and nurses and physicians, because if we're not healthy, then we don't have a way to care for people who will come to our hospital. So again, our first objective is to keep our providers and staff safe. The second is to care for patients with the state-of-the-art care available for COVID-19. The third is to participate in the public health response. So that's why testing is helpful, not just in the local community, but also in the state and on a national level. And then the last thing that we do, our fourth objective, is to try to reduce the downside of the financial impact of dealing with a global pandemic.